Jamie, for as long as I've had ears and eyes, people have moaned about NHS not working, waiting lists, and not enough beds, flu season, and all the rest of it. But I can't remember things being as bad as this. Am I just sort of looking back through rose-tinted glasses, or have things markedly slipped?
Yeah, good morning, Alex. So things have markedly slipped, in part because one of the health benefits over the last, say, 50 years is we are living longer. We've got a lot more people over the age of 75. We're at that point now where there's a lot of babies born after the Second World War. They're hitting the age of around 70, 75, going towards 80. And that's where you significantly see the ramping up of the needs of the care on the NHS. So pretty much where the NHS and this 80% of hospitals are failing, this is pretty much down to not just this government, but all the governments previously have not put in the kind of, I wouldn't say the money, there's plenty of money going in, but also, are there enough beds? They've cut the number of beds over the last kind of 20 or 30 years. So the money's probably adequate, but is it being used effectively? And that's where the mess that we're in. And then obviously, Alex, with the COVID pandemic, telling everybody to stay home, protect the NHS, led to that massive rise in waiting lists, and the government just cannot get them back down.
One assumes strikes are also a problem, having contributed to the waiting list as they started to at least drop slightly. Where are we in terms of the context of the developed world when it comes to our healthcare?
Yeah, so I suppose the first thing to kind of highlight there is, the NHS was formed in 1948, and no other country has chosen the model that we've got in the UK. So, if something works and it's world class, which is something that we've always told, you would copy it, and we don't see that. Just over the water, France, Germany, Netherlands, they have a different model, looking kind of social insurance kind of model. So in terms of our survival rates for things like cancer, we are not at the top of the league in those. We're pretty poor, and that's ultimately what we're looking for. These league tables that have been published, they don't make the waiting lists come down any faster. In fact, some of them, the differences can be explained by some areas are sicker, some areas have got older people. But ultimately, the government, the more stark thing, Alex, for me isn't just these numbers today. If you just look at the 2040, we've got 6.5 million people today, 75 and over. That's going to rise to around 9 million people now by 2040. So that's a 37% increase. Where are the hospitals? If you think the NHS is in a mess today, it's going to be a lot worse in about 15 years' time, when I'm going to get a lot closer to needing to use the NHS yourself on a more regular basis.
So what is the solution to all of this? Should we by now, tell the unions to jog on and set up a European-style healthcare system? Because I remember when I was living in Brussels, I thought the healthcare over there was pretty exceptional. It seemed to work like clockwork. If you had a job, you had health insurance. If you didn't have a job, you had state-supported hospitals, and therefore were, your care was based upon welfare. And what I found was, they're not a sociable lot over in Brussels, particularly. They're a bit like sort of, Londoners. They don't talk to each other. But when I broke my ankle and was hobbling down the street, everyone wanted to come and have a chat with me, because the first thing they ask is, what have you done to your leg? Where did you go? How was the treatment? Small talk over in Belgium is basically, which hospital should I pick? And I think as a result, it's driving up standards over there. Could that model be replicated here?
Well, I think so. Keir Starmer and West Street have talked about reforming the NHS, but one of the things, there is no national health service in the UK. Let's kind of cut that one out, because all these different trusts in England are run differently. You've got Wales, Scotland and Northern Ireland where it's devolved, and the Labour Party had control of the NHS for over 25 years now in Wales, and they've had ample opportunity to reform Wales to see what works. So there's no national health service. Let's park that. So the important thing when you talk about reforming the NHS is, as soon as it's mentioned, none of the political parties then will go through with any radical change, because all the headlines, the media will say, you might introduce more privatisation, this isn't fair, should be free at the point of delivery. But I think some radical look at this needs to be done in terms of, if no other country's copying us and we've got worse outcomes, it's not a rocket scientist is needed there, Alex, to say, let's go and copy what somebody else is doing. It's common sense. But this government has clearly not got any common sense.
I've never understood either our mad approach to training and retaining doctors and nurses. This crazy idea that you've got to have a cap on the number of people who can take medical degrees, and then say we haven't got enough people, we're going to have to import them from the developing world. Well, I'm sorry to say, sometimes the standards of English are not befitting to someone in frontline medical care. Some of the things that seem to be still extant in the health service, and for that matter, something that's still extant, is NHS England. I thought they'd got rid of that thing.
Yeah, on the training point, you're spot on there, because I think personally it's immoral to have to take healthcare workers from other countries, because every country in the world needs healthcare workers. So if they're investing in the kind of population to develop new doctors, new nurses, and we just go and import them, forget the immigration point and the needs of our NHS. It's surely immoral to start taking other people from other countries when we're putting limits on the numbers in our country. And you're spot on there. And I think that's part of the issue. It's that planning that we just discussed at the start here. If we've been planning ahead, the population figures that the ONS produce are there, and they've been there for many, many decades to see what are the demands the NHS will need. So this is complete failure of the government. Say this is going back 20, 30 years of government, because if we don't get those spades in the ground now for those numbers we talked about in 2040, it's going to be a lot worse. And I can see it like on the government.
Oh, you little doomster. But no, my second point was also NHS England. Didn't the government announce that they were going to scrap that? And apparently someone told me that the cost of actually paying all these people redundancy money is so much that they've kind of decided they're not going to do it. Shh, don't tell anyone.
Yeah, well, scrapping these things, I think they are planning on doing that. But when you just scrap a body, another body just comes up anyway. I think the point of this is to get the government to have more day-to-day control over the NHS. And I suppose that's not ultimately a bad thing. If we hold the government to account on fixing these things, having more public sector workers kind of at arm's length from the government making decisions that could be poor is pretty poor overall anyway. So that's probably a good move, but you're right on that. This is just a complete mess. The figures today are showing that, and we need change.
Jamie Jenkins, former head of health analysis there from the ONS, thank you ever so much for coming on the programme.